We are implementing individual PM Plus in Switzerland in Syrian refugees, meaning that for refugees which have arrived after the crisis in Syria, arrived to Switzerland. This is very important in terms of offering any kind of intervention as, for example, in Switzerland, if you need some kind of help, there are different barriers and difficulties. For example, if there's no interpretation, if you go to a GP or if you go to specialized care, and so you don't get all what you need, for example. And if you go to a highly specialized service, you need to wait for up to a year to get the first session, to get treatment. In terms of that, it's very important to offer and to provide something which is not highly specialized, but it helps still people to manage their distress and their problems.
We're doing a similar study in Jordan, except whereas NASA's focusing on an individual delivered PM+, we're doing it in a group format. So we're still doing it with Syrian refugees, and this particular study will be happening in a camp called Azraq Refugee Camp in Jordan, and it's in partnership with IMC. And what this project is trying to do is test how well can PM+ at a group level actually reduce psychological distress in the refugees. But what's an interesting twist on this is that we're also going to be assessing, does it actually have an impact on the children of the refugees? So even though we're not actually providing any programs for the children themselves, by helping the parents, can we actually detect that the children are actually better off? So hopefully their parents' distress is reduced and maybe their parenting has improved, and if that's the case, then we might see an effect in the children as well. Okay, in Jordan, it's happening in a camp, the refugees. It's a camp with about 30,000 people in it. The way we're going to run it is it'll be a trial where people are randomised to either getting the group PM+ or what we call treatment as usual or usual care in the camp. So what we'll do is we'll do a lot of community awareness raising in the camp, but then essentially we're going to have people going, if you like, door to door, and if there is an adult refugee in the camp, in that household, who does have a child, then we'll assess them. If that person is actually indicating they actually have distress, then we will invite them into the trial. If they agree, then we'll do a fuller assessment on them. And then, which is happening across all the strengths studies, we'll then randomise them to either getting the group PM+, or they will then be given very specific referral details as to where else in the camp they can actually get help for their distress. Now, if they are randomised to PM+, then what's going to happen is we'll run these group programs. There'll be some run for women and some run for men, and they'll be run by groups of 8 to 10 people, and there'll be 2 facilitators running each group. There'll be a Jordanian facilitator as well as a Syrian facilitator. And the goal of that is we're trying to build up the capacity of Syrian refugees who can actually provide the intervention. Because although this is a sort of a pretty standard trial, so we're going to be doing this in a very structured way, and then we're going to, at 3 months, go back and assess people independently and work out how well did Group PM+ function relative to the usual care. And then we will then follow people up at 12 months again. But critically, what we're going to be doing in that window of time is we're going to be training up and implementing PM+ to a lot of other agencies. Not just in that camp, but hopefully throughout Jordan. Because the real goal here is that we can get other NGOs and agencies on board who want to learn Group PM+. They can get trained up, they can then start implementing it in their own agencies, both in camps and in the communities. So the whole idea is that the more people we can train, including Syrians, then the better reach we'll get. And I suppose, Nasa, you'll got a similar goal in Switzerland?
We're having a similar goal in Switzerland. We are having a different setting, so we're not in refugee camps, so that's why we're going to address in a different way the refugees living in Switzerland, collaborating with Syrian NGOs, for example, and trying to approach Syrians living in Switzerland and then delivering and providing PM Plus in their to them. Regarding the intervention, it's going to be the same, except it's going to be in us in individuals, whereas you're doing group. And we're going to provide that one in 3 different regions in Switzerland, which will be then supervised by the outpatient clinic for victims of torture and war, meaning that they're going monitoring that one, and as you just mentioned, they're going to be trained, everyone's going to be trained in PM Plus, but be supervised by those clinics if anything happens. And the idea is that later on those clinics then will carry on and be as well in charge of the implementation later on in the healthcare system.
And what's interesting when we compare Switzerland with Jordan, completely different healthcare systems, completely different challenges, but they're actually just as big a challenges, even though they're just as different. It's fair to say Switzerland's probably got one of the best healthcare systems in the world.
Yeah.
And what's remarkable is that refugees can access that healthcare system, which is just enormously better than what's available in Jordan and in the camps. But these wonderful healthcare providers in Switzerland don't speak Arabic. And so in a sense that it doesn't mean anything, the fact that they can actually get access to healthcare, because that language barrier is there, which is why you need this sort of intervention, because you need Arabic speaking and preferably Syrians to provide the service.
And the barriers are actually quite high to get to a service, actually. So sometimes being a refugee doesn't mean that you're allowed to leave your region, so you don't have, for example, like travel costs. Who pays for that to get to a special treatment? That's why having a lower intervention which can be delivered by peers might have a good impact on their distress.
And what's the average wait list to actually get into a refugee clinic in Switzerland?
If you would refer today someone to our clinic, this person would have to wait for a minimum of 9 months.
Yes, and that's again just highlights one of the great barriers to care, even in a really highly developed country like Switzerland.
But in average, someone usually goes after 6 to 7 years to a treatment. So you're being there for several years, living in Switzerland with all this distress, in addition to also living difficulties, post-migration living difficulties, which you're facing in your daily life, like with work or not knowing the language and so on. And you have to wait such a long time to get treatment.
I think that is another part of the motivation in the Strengths Consortium, is that it's not simply does this particular program work or not, but it's about how do people actually access it. So you'll have refugees sitting in a refugee camp or sitting in a housing sort of settlement in Switzerland or anywhere else, but do they actually know how to get help?
Yeah.
Do they need help? Can they identify the fact that they are distressed or not? Now, really, the way all the different sites are working, including Switzerland and Jordan, is we're using different models to do it. So in both of our cases, we're actually going to people, we're knocking on their doors, and we're actually screening them, which is really a very different model than what most people use, because it's very proactive, screening, community, raising the community awareness. If a person actually wants to take up the offer and come to help, then it's always up to them, but it is actually taking that extra step forward.
Well, offering possibilities to get treated, I think that's the goal.
Hmm.
Yeah.